Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? I'm Morgan, and today we have a special bonus episode of Pulse Check. We're going to be diving in from that journey from an RN to an NP. I know there are many of you out there. Maybe you're here already. Maybe you're thinking about it for the future, where you're starting to wonder, what's that next step for you? Do you want to go back to school, get an advanced degree? A nurse practitioner, by the way, is just one of the things you can do with an advanced degree, but we get a lot of questions about the NP role. So today we're going to talk through what that looks like with someone who's been there. So welcome to our guests. We have the wonderful Hiva Kolodrobetz. Hiva comes to us with over 12 years of nursing experience, I think maybe 13 now, and 10 of those are as an NP. Specifically, Hiva is a family nurse practitioner, so an FNP, and she has a ton of experience both in primary and specialty settings, ranging from community health, internal medicine, cardiology, rheumatology, endocrinology, urgent care. She's done a little bit of it all. And I think you have pediatric background as well. Is that right?
Pediatric endocrinology. Yeah, that's right.
Pediatric
Yeah.
endocrinology.
Yeah.
Fascinating. So welcome to Pulse Check, Hiva. We're so happy and grateful that you are taking the time to be here with us today.
Oh my gosh, I'm thrilled to be here. I love talking to my nurses about the NP track. So I'm super excited for today's conversation.
Yay! Awesome. Well, let's jump right in because there's so much goodness to talk about. The first thing I really want to hear from you is just what your journey looked like. Tell us about how you transitioned from RN to NP.
Yeah, I love telling people about this because there's no one track to becoming a nurse practitioner, and I want students to understand that. My track, I think I went the long way, but long way for me. I became a nurse as my second career. Way back in my undergraduate world, I wanted to go into healthcare. I come from a long line of healthcare providers. And I had an advisor who advised me to go a different way. And I found myself when I got into industry, I went into pharmaceuticals, I was gravitating towards those healthcare roles and not feeling gratified or satisfied with what I was doing. And I had to do a lot of deep search and be like, well, what is it that I'm liking about this role? What is it that I'm not liking? And I realized that I just wanted to be a nurse. I wanted to have that meaningful, warm touch with my patients, make real impact. And I was like, I'm going to go back to nursing school. And I went back. My mom was like, well, what about NP? And I was like, I don't know what an NP is. Tell me about it. I started reading about it. I started seeing NPs everywhere. And I was like, what is this track? And I hope I'm not dating myself by saying it, but as a nurse, I really struggled. I was brought up and lived in an area which was very oversaturated by healthcare providers. And so I
Yeah.
struggled finding nursing jobs as a new grad. Nobody
Mm,
wanted to invest in a new grad because there were so many experienced nurses. And
yeah.
I happened to fall into this role at a federally qualified healthcare center. And I was thinking about it more as like a stepping stone to get into a better job in my head. And it opened up my world. I think it was the best thing that happened to me. I realized what really, truly a nurse practitioner is and what nurse practitioners do in the community. It was a clinic run by NPs, started by NPs, and I fell in love with it. And I was like, this is it. And they were affiliated with a program with the hospital in that community. And it was just this wonderful open feeder from the school with the nurses and the nurse practitioners. So it felt like home. So it was just natural transition for me.
That is incredible. It's so often you don't hear that it's a smooth journey. You hear it can be very segmented. I know for me, I did not go from, school to a hospital right back. Like it was a little bit choppier. And like you mentioned, there's no one way to go about this.
Yeah.
It's actually compare and contrast with our chief medical officer, Steve. There is pretty much one linear path to becoming a medical doctor. And that is not the case in nursing, which I'm really grateful for
Oh,
because we get a
100%.
much more diverse pool of wonderful future nurses from all over the place because there are so many ways, first, to become a nurse, and then secondly, if you choose to go and become a nurse practitioner.
I 100% agree with that. I think for our students to understand that there is more than one path to hospital nursing, it's really important. So open your world to all the possibilities of nursing, and it'll really open your world to advanced practice because there's no one way to be a nurse. And I think we traditionally are taught that in school. So everybody thinks, okay, got to get that job in med surge and then got to get that
Right.
next job. And it's just open your world up. And that's what I've loved about being a nurse practitioner this last decade is I really, as you read my bio, it kind of sounds funny, but I've really tried whatever I've wanted to try. And if I
Yeah.
went the traditional, very structured MD route, then I would not have had that opportunity. I wouldn't
Mhm.
continue to have that opportunity, which I feel
Yeah.
would frustrate me because I'm definitely an a la carte kind of person.
I love that, an à la carte kind of person. And, I bet it makes you a much more well-rounded provider too, because you're taking bits of here and learnings from this, and how did things work at an FQHC that I'm sure some things were great and some things left a lot to be desired. And
Oh,
that's
yeah.
pretty much true of everywhere.
Yeah.
But when you have that breadth of experience, you can pull from the best of this and that, and your knowledge of endocrinology versus cardiology, they all start to work together.
Oh, 100%. I'm now back in primary care. And when I was in specialty, I pulled from my primary care, especially my colleagues who had always done specialty. They were like, Hiva, what do I do with this? And then
I
now that
bet.
I'm back in primary care, I feel so much more robust in that specialty. So I pull from
Yeah.
that, and my patients are like, where are you from? And so really fun. And I tell my students, try different things. That's the
Yeah,
beauty of nursing, right? And that's what I love about it. You
absolutely.
can really try all these different avenues, see what you like, see what you don't like, and then bring that experience to every job. So you're absolutely right. There were things that worked well in a federally qualified healthcare center that when I went into internal medicine, I thought, oh, let's build this out. And as nurses, we're leaders. We can really
Mhm.
implement those programs in our clinics and improve the processes, which is what I
Yeah,
love doing. So, really
yeah,
having that breadth and those experiences to pull into different settings is really fun.
yeah, absolutely. So, my next question for you is how you knew you were ready, or I mean, are any of us ever really ready? But for you, how did you know it was time? I'm going to make this leap from being an RN to an NP. I'm ready to start this part of my journey.
Yeah, that's a really good question because I don't think I knew what I was signing up for. And I will be perfectly honest with that. I think I had a strong support system. So, a lot of FNPs who went through this program, and this was a long time ago. I know the landscape's so much more complicated now, and we can get into that as well. But I really had such a great support system because the NPs that I worked with saw my work as an RN and they were like, you need
Mhm.
to do this. Like, you need to be one of
Okay.
the providers here caring for this community. It just increases your scope. You're able to do same things that you're doing now, but just autonomously
Mhm.
without standing orders. So it was something that I think I didn't really know what I was getting into, so it was easier to go that path.
Yeah.
Whereas I think now that I know more, I'm like, well, would I have done it again knowing the gravity of the job? Like, I just thought like it was going to be this beautiful community, supportive environment. And now I've left that environment for life circumstances. And I'm like, I miss that. I miss that community, right? But
Absolutely.
absolutely. But at the same time, I'm so grateful and I would absolutely do it again and I would absolutely
Yeah.
recommend it to anyone. But I
Yeah.
think I made the decision because I was young and I didn't really think it through, if I'm being perfectly honest, like
That happens.
100%. Like,
Yeah, you made that leap. And it sounds like it was very much the community you were working in, or the facility perhaps is a better word. It was an NP led environment, so that was role modeled to you and you saw it a lot. So we probably have some listeners that don't totally know, like, what does Hiva do as an NP? Maybe they're in an environment where they're not seeing a lot of those providers.
yes.
Give us the rundown, like the down and dirty, Hiva. What does your day look like at the clinic? I know you were at the clinic yesterday. Like, what are you doing as an NP, as an FNP in primary care?
So now I'm in primary care and I am the only NP in the clinic. I have one medical assistant. I'm on my own. I see patients, either they're scheduled for chronic visits or they come in for acute visits. Just yesterday, we had a flu clinic. So people coming in to get their flu shots, and then they answer the questionnaire and they're like, oh, I'm not feeling so great. And then they get thrown on my schedule. So it was a busy, busy day. But it's definitely a job where I wouldn't have felt comfortable doing that on a day to day if I didn't have the
Yeah.
experiences that I've had before. So that supportive environment that I'm describing is so important. I think it was absolutely the catalyst that got me to take the leap. I don't think
Yeah.
I would have felt comfortable if I didn't really see those role models doing it and seeing how
Yeah.
supportive they were with each other when they ran into issues that they hadn't seen before. Just the
Sure.
discussions they would have in the back office and the candor and
Yeah.
the freedom and to be honest and just ask for
Yeah.
help. It was beautiful. And then I had a very similar experience as a new NP in internal medicine. I had a very supportive community. And I
Yeah.
remember that first job. I remember the very first time I had to send in a prescription. It really scared me because that was the biggest difference between being an RN and an NP.
Mhm.
As an RN, somebody else had the standing orders. I would go to them and say, hey, I'm thinking this, but it was never on me. They were making the final call. And then
Yeah.
all of a sudden, even though I had gone through all the training, I was like, oh, I am the
Yeah.
one responsible for this.
Yeah.
And it gets really, really scary, especially for the
Mhm.
now I do it without thinking about it. I'm like, oh,
Right.
now we're going to treat it. This
Yeah.
it becomes very natural. And then you start to have like
Mhm.
conversations with your patients, get to know them. As a new
Mhm.
grad, I don't think I was that calm and cool at all. I was
No.
just like,
No.
this is the medicine. And I'd see more experienced providers doing that. And I'm like, oh, like, when do they have time to have these conversations? Like, and get to these patients?
It's so funny. What you're describing resonates deeply with me. And I just had a flashback to both a moment as an RN and a moment as an NP where I transitioned from feeling like, oh my gosh, this is so daunting. How are these people doing it? To realizing like I'm now doing it. As an RN, it was drawing an ABG in the ICU setting. I remember watching, I'm like, how do they navigate this line? This is so scary. It's connected to an artery. What if I mess it up?
I know.
And, that's a skill you'll very quickly obtain if you're working in the ICU. And by the end of my time there, it was second nature. And then the exact same experience he was describing the very first time I wrote a prescription. Mine was for amoxicillin. And if you know pediatrics at all, amoxicillin is like the bread and butter. So you deal with
Yes.
strep throat and ear infections a lot.
Yes.
But it was still so scary. Like he was describing the first time, I'm like, did I check all of the allergies? Did they have a contraindication? Like, were their kidneys okay?
Yes.
Like these things that I'm like, yes, Morgan. It was a classic
Oh my
ear
God.
infection. Like this, but your name's on the dotted line. I
Yes.
mean, you have to know your stuff.
Yes, 100%. And then when you send it electronically and there's no like other person, like I remember I would like call the pharmacist and be like, is that okay? And she's like, are you a new grad? Like I'm like, I
She's like,
quick
I'll
double
I'll check
check
it for
me
you.
with the dosage
Quick
that I
quick
can
shout
calculate.
out to all the pharmacists because they're so fabulous, always answering all the
I know I
questions.
love my pharmacy partners, but it was just so funny because it is really scary. But now the way I see clinic, like yesterday, I had so much fun. Like it is a social scene for me, even though it's really busy. Like I love it, especially working more
Yeah.
remote now. And I'm a
Yeah.
social person. I'm a social
Mhm.
butterfly. I've always been a social butterfly. So I love that. And then now that I really have a balance between teaching
Mhm.
and being in the clinic, I'm
Mhm.
feeling so fresh when I walk in. I'm
Yeah.
feeling so
Yeah.
fresh and energized when I walk out. I get to see the same patients because it does have that continuity of care.
Yeah.
So I know the providers that I'm covering for. I know how they would do it. I know how I like to do it. I know the medical
Yeah.
assistant. I know the staff. It's just so nice. Like it's just
Yeah.
not stressful, it's fun, it's light, and we're doing great things for our patients. But it
Yeah.
took a while to get there. That definitely like
Absolutely.
I would have panic attacks driving to my first job, and I tell my students like I had to bring sets of clothes because I would just sweat through my clothes.
Oh no.
I was just like I'm a nervous sweater, so I would just like sweat through my clothes and I'd have to go in the bathroom, change, come back.
Oh,
Like it was definitely
it's not easy. It's not easy. And circling back, Hiva, you've talked a lot about in your new grad experiences and before you were in NP and you made this leap, having a really supportive community. And that's critical,
Yeah.
but we're not all lucky enough to be working in those environments. So before I move to my next question, though, I just want to touch base and number one, like recognize if you are not feeling like you're in a supportive community, you're not alone. I don't want you to think like what Hiva's painting is what everyone else is experiencing.
Oh, yeah.
We know it is
I
really, really hard.
Yeah.
And just quickly ask you, Hiva, do you have any advice for those who maybe aren't in a supportive community, resources, anything that they can do? Because sometimes that's out of our control.
No, 100%. And it can get really frustrating as a nurse because you're a good
Yeah.
nurse, you care, you're like, why am I in this situation? This
Yeah.
is an unhealthy situation. I feel like my license is at risk. How many of us identify with that statement? And I've been in those
Oh,
statements,
yeah.
right? I'm definitely
Yeah.
looking at it from rose-colored glasses and saying, like,
Mhm.
and I'm in a good position now, but that wasn't always the case. It was tough. I went through a lot of tough transitions. That's why
Yeah.
I tried a lot of different practices.
You
And each
have.
time I took away the good, but
Yeah.
there are a lot of roles out there that aren't supportive. And this is my big point of advocacy for our new grads. I really want you to advocate for yourself. You are entitled to having a supportive community. You don't get out of school knowing everything. You need to be continuing to learn
Yeah.
and you need to have a community that supports that. And if you don't, that's okay. You're absolutely not alone. Unfortunately, that community is very far and few between. And how do we find those great communities? That's a really great question. You need to get out there and talk to people. You need to
Mhm.
dig. You need to go to your local chapter meetings. You need to reach out to people who have gone through programs. If they know any clinics that they do a lot of student preceptorships with, usually those clinics are very new grad friendly because they
Yeah.
know, they understand the training. They know that it's an investment in a new grad and they're not going to shame you for it, which is what I
Yeah.
see a lot in practice, especially with my
Yeah.
new grads who join practices that I'm no longer a part of. But I really advocate for my new grads. I say, no, you're a new grad. That person should not have said that to you. I'm glad you're coming with questions. This is safe, ethical
Yeah.
practice. You need to be coming with questions. And that's why I say in my current role, I wouldn't have done it as a new grad and I don't recommend it. You don't want to be in a clinic where you're by yourself. You don't want to be
Mhm.
in a program where you're feeling isolated. You want to be looking for
Yeah.
programs where you have a community, you have colleagues, you have study buddies, you have that community. And the best way to look for it is to reach out to the programs. If they're responsive, that should give you a clue. That's good.
Yeah.
Talk to students who have gone through the program. Ask the program, do you
Mhm.
have any students that have gone through the program that I could talk to? That's a really nice way to get to know more about those programs.
Mhm.
When you're looking for that clinical role, go to those local chapter meetings and ask around. Where do people work? Are they happy? What do they like about their job? What do they not like about their job? What clinics have they heard about? And then maybe this is a little aggressive, but this is my generation. I like to walk into places and
Okay.
I do that all the time, and people get really surprised. And you learn a lot by walking into a place.
True. That's true. Catch them off guard, like see what's going on.
Yes,
What's the vibe?
absolutely. And I say things like, and I've moved around a lot, so I've had to do this a lot. But I'm like, hey, I just moved to the area. I'm a nurse practitioner. I'm just trying to get to know my community. Tell me a little bit about your practice. And that interaction with the front desk really tells me how happy are the people in this
Yeah.
clinic? Do they talk to each other? It's really telling. You would be surprised. And I focus on this too when I'm running my clinics to make sure our patients have that experience from the moment they walk in to the
Totally.
moment they walk out. Because how many times have you been a patient where you've walked in, nobody's even acknowledging you, the front desk is grumpy, and then you get back an hour later to see the provider's rushing in and rushing out. I mean, it's from everyone's miserable, right?
Yeah.
And it affects your care. You're like, was
Absolutely.
I taken care of today or was I just a checkbox, you know? Like,
Yeah. And a lot of times it is a checkbox.
yeah,
Visit times are short. There's a list of things that need done. You're totally right. So
yeah,
I like everything that you're speaking to. What kept coming to my head is interview your practice, interview your program. Like before you commit to anywhere, if you're an RN deciding, do I want to go to this program? Maybe you're trying to decide there's a lot of different types of NPs. Hiva's an FNP, I'm a pediatric NP.
Yes.
Go to those different programs, ask the questions. You're going to be spending a lot of time and money and energy in
Yes.
those places.
Yes.
So it's just as much an interview for you as it is for them, is what I'm hearing.
100%. Know your value and know that you are worth being in a place that values you and treats you well and treats you with respect,
Totally.
right? Because you spend the majority of your day at work. You
Yeah.
want it to be fun, but also respectful and meaningful and valuable, right? You don't want to feel like you're having panic attacks driving to work every day.
No, that is not the goal.
It's so hard. But in this landscape, I really do feel for my students, it is a much harder landscape. So when you ask me, and I feel really spoiled, like, how did you make the leap? I had three tracks to decide between, and it was the
Okay.
local school because there was no hybrid, there was no online. I literally was between family nurse practitioner, adult gerio, or adult gerio primary care, or adult gerio acute care.
That's
That was
cute.
it. And
Uh-huh.
I was like, well, I love my pediatric patients, so family is the right path.
So family. There you go.
But now look at the fields. There
Mhm.
are so many possibilities, not just in the NP track, but in an advanced practice. And so
Yes.
students, I think,
Yes.
get really stuck of like, well, where do I even begin? And I think having those conversations, thinking about the scope of practice, thinking about what kind of setting
Mhm.
you want to be practicing in is so important. And just know that those things will shift as you
Yeah.
get into your job. It doesn't have to be set in stone, but set yourself up for the widest casting net, and then the beauty of this job is that you can shift
You
towards
can
your
shift.
interests. So,
And another thing, a lot of people are starting to get dual certified. So I know for me in the pediatric landscape, especially working with our clients, we're seeing a lot of mental health concerns. So you can get like a sub certification in mental health, or you can go back and be a dual board certified psychiatric mental health nurse
yeah,
practitioner. So that's a track. There are, like Hiva said, so many tracks out there. And I think Hiva talking about looking at the scope of practice is a really good way to think of it. I've thought about it a lot of, who is your primary patient population going to be? Who are the people you're mainly going to be taking care of? So starting from the beginning, you've got a neonatal nurse practitioner, an NNP, and those are going to be mainly working in the NICU setting, normally not outpatient from what I have experienced with those preterm infants or infants that maybe have had some sort of complication and are in hospital. So infants and in hospital is what you're going to see for an NNP. And then going through the age span from there, a pediatric nurse practitioner, which is what I'm certified as, you actually have two tracks. You can be primary care or acute care. I did primary care, so I can see ages 0 through 18 in the outpatient setting. And then acute care, the same thing, but in the hospital setting. Then you have your family nurse practitioner, which is Hiva's specialty, which is again mostly outpatient. I have seen some FNPs in the hospital as well, like on specialty service or
yeah.
whatnot. So there's FNPs always amaze me. There's like a huge range of what you can see as a
Absolutely.
family nurse practitioner.
Yes, and you have to be a little careful with FNP because especially in certain areas where we don't have enough providers, even big hospitals, you can't just trust it. You have to know your scope and say, "Hey,
Yeah.
I'm not comfortable with that." I can't tell you how many times I've been offered ICU jobs and I'm like, "Nope, that's not
That's
me.
not what I
You
do.
need an acute care NP." And they're like, "So we need an
Yep.
adult gerio primary care." I'm like, "No, no, you need an
No, no.
adult gerio acute care
You
NP."
care.
But they're like, "But you'll see the patients in the clinic too." I'm like, "Okay, I'll do just the outpatient clinic
Just the
part. That
clinic.
sounds great." Like, yeah,
And if just the hospital part sounds good to you, then you should go or consider going the acute care route. So after FNP, you've got adult gerio. So those are gonna, correct me if I'm wrong, pretty much we'll see anyone after the age of 13, is it?
That's
Where that
correct. So adult
line is?
geria is similar to pediatric. They have a age range, so
Yeah.
13 plus. So you will see
Okay.
some adolescents, some pediatrics, but they also have two tracks. So they have a primary care track and a acute care track. So you can choose which adult certification you want based on those two tracks.
Yeah. And then we also have women's health nurse practitioners that really focus in on all of the care that goes into women's health. And that is typically a primary care role as well. And then, like we mentioned before, the psychiatric mental health nurse practitioner. So you've got some niches and specialties in there.
Yeah, and you've got
Did I
even
miss any?
more, I think the emergency nurse practitioner one
Understand.
now too. So a lot smaller group, but
Yeah.
definitely exists. I feel like there's one we're missing and we're going to kick ourselves after the
I
podcast.
know.
But
Probably.
yeah, yeah, but these are
You get our gist. Look at the scope of practice, look at the patient population you want to serve and where you want to be serving them. Do you want to be primarily in clinic? Do you want to be looking at an inpatient primary? Or I also know people that are in the pediatric world dual board certified AC and PC, and they do a little bit of crossover. So, like the role Hiva was talking about, you're going to serve in the ICU, but then also have some follow up in clinic. That would be great for someone who's dual board certified that has, kind of that full gamut. So
yeah.
there's a lot to think about.
There's a lot to think about, and I like the dual certification. I considered it when I was in cardiology because I was like, oh, maybe I do want to do the
Yeah,
inpatient side along with running this outpatient clinic so you could get
I can
acute
see that.
care track and FNP. Or now we're seeing a lot of dual certification with psych mental health because,
Yep.
like you said, we're seeing so much mental health in that primary care space. So we see a lot of students just right off the bat doing FNP plus psych mental health so that they can
Mhm.
serve their community because we're seeing a lot of
Yeah.
anxiety, depression, substance use that's being
Mhm.
managed in primary care. So they
In
feel like they're
primary
better
care,
equipped with it, with the dual
for
certification.
sure.
Yeah.
For sure.
Yeah.
So hopefully we didn't totally overwhelm you. It's good to have the choices, but I think Hiva's advice of talk to the programs, talk to people, that's really a great place to start, in my opinion. Just meet as many people as you can, get their 2 cents. They give you input, you make decisions. No, don't take anybody's word but your own, but really just kind of hear what all is out there to inform those choices. That would be my 2 cents. Hiva, if someone out there is like, okay, I'm thinking about NP school, what Hiva described sounds wonderful. I'm not totally sure what my next step is. Give us maybe like 2 or 3 actionable steps people could take to start along that path.
Love that. Step number one, if you're coming from a nursing background, start a list. What do you like about your role? What would you change about your role? And
I
think
like
about
that.
the things that you talked about. So, which patients do you like taking care of, that patient population? And which settings have you enjoyed in your nursing practice? So, that's number one, because I think that really will help you kind of tease out what you like and what you don't like. And then step number two, think about the nurse practitioner role and start talking to some nurse practitioners and really get an understanding of what it is that a nurse practitioner
Yeah.
does. Do you want that full autonomy? So the role is really transitioning and changing. We're no longer seen as mid levels, which is a term that even when I was in school, our educators really disliked. We're no longer an assistant. We are really filling in those healthcare shortages and those gaps in primary care and in specialty care. So, is that something that you want? Do you want
Yeah.
that autonomy? Do you want to really be taking care of patients and having the final word? Or is that something you rather somebody else tell you that, yes, that's okay, or no, that's not okay? Because that's the main difference between the RN scope of practice and the NP. And then I tell my NP, my RNs considering it, I'm like, you have so much experience. Think
Yeah.
about that and be confident in that
Mhm.
experience. This is how the NP job came to be. They saw experienced RNs and they thought, okay, let's give them autonomy to take care of our
Yeah.
patients because we need more
We need
qualified
it.
clinicians.
Yes.
Yeah. So, top two things, write down the things you like about your job, including patient demographic and setting, and then start looking into the nurse practitioner role. Is it for
Okay.
you? For those
Yeah.
not in an RN track, it's really becoming popular to go straight through to graduate level or doctorate level from all kinds of background. One of my students,
Yeah.
he just left investment banking and now he's going to come out as
Oh,
MSN.
that's a big pivot. Yeah.
Huge pivot. He's going to be an amazing nurse practitioner, but start thinking about what you want from your day to day. Do you want really a schedule of patients like I described, where you're going in and out of rooms, treating them medically, getting to know them personally, taking care of them, their family? What do you want your day to day look like? Or is it something else? Is it you don't really want that? We call it hamster wheel, right? You don't
Yep.
want
Yep.
out of one room to the other, right? So start really talking to people. What is a nurse practitioner? What do they
Yeah.
do? And watch some
Yeah.
NPs. If you can
Yeah.
shadow, that's great. Talk to alumni, talk to programs. And when you're trying to decide the programs, please reach out. Don't just blindly
Yeah.
throw your application out there based on ratings.
Yeah.
Ratings, I have no idea. I tell my husband all the time, I have no idea what these ratings are based off of. But
Where are you coming up with these
come up with
numbers?
these numbers, but reach out to them. Who reaches back
Yeah.
out to you? And what is that
Yeah.
gut feeling that you get, right?
I love
Do
it.
you feel
I
like
love it.
they're going to support you through this training
Uh-huh.
because it's
Yeah.
extensive? Or do
It
you
is.
feel like you're just a number to them? And
Yeah.
that's going to make a difference because, especially if you're considering remote part time, so you can work as an RN while you're
Mhm.
going back, or you're still keeping your non medical job while you're getting into this new field, you really need to be thinking about finding a supportive environment where you don't feel like you're doing it by yourself. And
Right.
there's so
Right.
many ways to get engaged, even
Yeah.
remotely, and there's so many programs that
It's
do it
true.
well. So get into it and start having those conversations.
I agree. I love what you say. Like, you don't need to do this alone. I say to our students here at Archer all the time that this takes a village. We were never meant to be doing this alone. Nursing, which includes advanced practice nursing, is a team sport. So I think that's maybe my key takeaway of this episode is like, do your due diligence in finding that supportive community. If you're not somewhere that is feeling supportive right now, if you're not somewhere that's going to support that transition from RN to NP, take the opportunity to really interview potential programs and potential clinics. Reach out to your local networks. Reach out to us at Archer. That is part of why we're here at Archer is we know it's not necessarily easy to find that mentorship and guidance. We want to be your advocate along the way with you. So we'd be thrilled. I know Hiva would be thrilled to help is in any way that we can. So I think that's really the key takeaway here is we don't need to do this alone.
Yeah.
So finding that supportive community is key to the RN NP transition.
100%. You took the words out of my mouth. Healthcare medicine is a team sport, and we really need to be supporting each other and doing it as a team. And you're never alone. I love getting those emails from students. I love working with students. If you can't find your community, come to our
Yeah.
community. You're
Yeah.
here listening to the podcast, so you're already one step forward. But
That's
come
right.
to our community. We love supporting
Mhm.
you. We love telling you our journey. We could talk for hours, Morgan, between the two of us about
Yes.
our journey. These are just the highlights, but there's never a perfect path. You're never going to be
Right.
ready. You just have to take the leap.
Take the leap.
Yeah.
I love it.
Yeah.
Well, thank you for talking to us today about your journey, how you took the leap. I love the supportive community for RNs, new NPs, and all sorts of advanced practice nurses that you're creating here at Archer. So thank you. Thank you a million times for your dedication to this profession and for sharing your knowledge with us today.
Thank you, Morgan. I had a lot of fun. This is such an important conversation to have. So thank you for
So true.
allowing the platform.
All right. So thank you guys for tuning in here at Pulse Check. Thank you to Hiva for sharing. And we will be back next week with another episode. All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.